Live now. Welcome, Dr. Nikhil, sir. It's been an honor to invite us in the webinar. So, sir, let me introduce our program to you. Sir, we are organizing this webinar under the Hack and Reboot 2.0, which is funded by Ministry of Electronics and Information Technology, Government of India, which was launched on 11th November 2022. This webinar will focus on the identification of problem statements and innovation areas in the healthcare domain that can fulfill the gaps in the existing industry. So I would like to give an overview of your experience to our audience so that they can be well aware of. So to bring the enlightenment and awareness of this domain, we have invited our eminent speaker, Mr. Nikhil Mehndi, who is the President and COO at Exponential AI at the United States. Dr. Nikhil Mehndi is a seasoned visionary executive with over 20 years of experience in healthcare sector, working with payers and providers. He has successfully led large-scale transformation and enterprise-wide initiatives for Fortune 500 organizations in the US, South America, the Middle East, and Asia. He has extensive experience in conceptualizing and transforming health plan operations, population health, clinical integration, and network management process through automation, cognitive learning, and strategic sourcing. He has been honored with the title of Top 100 Healthcare Leaders. He has recently been recognized among the most influential young leaders of 2021 award for his contribution to the advancement of technology, particularly AI within healthcare. So now I am handing over to Dr. Nikhil Mehndi, who is the speaker of the webinar, to start and share the knowledge, future aspect, and challenging in the healthcare sector. Over to you, Nikhil, sir.
Thanks, Imran. So yeah, I'm hope I'm audible, right?
Yes, sir, you're audible.
Perfect, awesome. So again, I don't have any slides intentionally. I wanted to keep it open for this group. I'm deeply honored to be a presenter today, speaker today. I have been a part of the this incubation program for almost last year and a half, and also helped quite a few startups. All health tech focused startups in the last 5 years or so. Apart from being the president and chief operating officer of Exponential AI, which is also one of my largest ventures. I also have Seed Tree Ventures, which is an angel investment fund that I am actively pursuing, transformational healthcare ventures focused on healthcare technology. Now, when you talk about healthcare, various people have different definitions of healthcare. Well, when some people talk about insurance, some people talk about hospitals, some people talk about clinics, some people talk about home care. Ultimately, if you boil this down and at 100,000 foot level, what healthcare is about? Is it about curing diseases, preventing diseases, or treating patients? And that's a fundamental question that we should be answering on what's the one primary objective of healthcare. And for me, when I think about this question, I think of it as like improving mortality. The lifespan of every single human on this earth should get better. And that's the true success of healthcare. Whether it is by preventing diseases, whether it is by curing diseases, ultimately you should be able to live life longer and live life happily. If healthcare is focused on that, everything you do in healthcare, if it is aligned with that, you are making healthcare successful. You are achieving that objective. Now you go to this and they take it to a next step, is how is healthcare practiced, right? So today, if you look and healthcare, it is a big topic of discussion. If you look at America, it is the second largest industry that drives the economy of America. The entire healthcare economy in America is $1.3 trillion. So US is one of those countries where they have privatized healthcare. But if you look at Canada, the entire Europe, Australia, healthcare is still public, which is government funded healthcare. So ultimately, the taxpayer dollars is the one that funds the healthcare. India is catching up. Most of the South Asia is now catching up. Insurance is becoming more and more common, but we are, I would say, still a 5 to 10 years away from adopting the institutionalized format of healthcare. What that means is, if you look at the rest of the world other than Asia, they have adopted the international coding standards for healthcare. They have adopted sophisticated EMR systems. There are healthcare exchanges that share data. When you talk at the aim of how we are improving mortality, you have to have a broader view of the population and what are the health trends of the population, and then drive policy changes that result in that improvement of the population. But here is the unique part about healthcare. If you look at a car or a truck, you can tell what exactly the problem with it is. Even though you are not physically in front of that vehicle, you can diagnose it remotely. Healthcare, no two human beings have the same body. Even though the parts of the body are the same, because of the multiple reasons, lifestyle, socioeconomic conditions, genetic inheritances, no two humans will have the same body. So same issue or the healthcare. Healthcare is very unique to an individual. So you have to start broad by saying, here are what the trends are. But ultimately, for healthcare to be successful, it has to make an impact on every single individual. Yeah, and that's what is the challenge that healthcare has to solve for. So if you look at all the companies today, startups, global companies, they are trying to solve for this challenge. At a macroeconomic way, they know what are the healthcare challenge. That's what the data tells them. But to make that data move, you have to impact every single individual that forms that data. And that is not only very expensive, but mobilizing that is extremely difficult. And that's what makes healthcare very unique. So if you look at like statistically, healthcare inflation in the last 15 years has been almost 20+%, which is a lot, right? If you look at, especially as healthcare matures, there is more and more infusion of technology. And this technology infusion is to do two things: improve access for healthcare and to reduce cost of healthcare. And those are the things that are the two areas where there is a significant innovation happening today. If you just answer the question, is the doctor's role to treat a disease or to cure a disease or to treat it changes the perspective of how you use technology in the large scope of healthcare. So some of these things are really big questions to answer, because it's fundamentally challenging how mankind has thought about healthcare before. So there are companies like 23andMe now who are taking genetic samples from the time you are born and predicting the immunology of every individual so that you can actually have a better, healthier life in the future. Now that's prospective. And then there are many companies now who are trying to, some of them are actually being incubated by you guys, and they are trying to predict a potential life event and try to drive an intervention so you can save these potential life events. So the regulatory piece, regulatory piece of it is also a challenge. So from the perspective of what healthcare is about today, it is about improving access to care and making it more affordable. If you take this 2A philosophy, where whatever I do, I want to improve access to care for an individual who needs healthcare attention, and I want to make it as affordable as possible, you are solving the biggest challenges in healthcare today. Even today, if you take in India, the ratio of population to a CT scan machine or an MRI is very different from a ratio of that ratio in Europe or Asia or Australia. It's somewhere like 1:500,000 is an MRI. For every 500,000 population in India, there's one MRI machine. The same ratio is like 10 or 15,000 in US or Australia. Is that the reason? Is that how we want to change healthcare? The question to answer is, do we need MRI for everything? Can there be more affordable things where we can diagnose the same without an MRI? Right? Do we actually need a doctor to know that you need an MRI? Can there be any handheld devices that you can do yourself so you can navigate your health better and go to the right doctor? Those are the questions that we need to ask so that we can simplify our own healthcare experience. So there's a lot of not only funding available, but also demand for remote monitoring, RWD, which is you will hear that term a lot more in the future. It's called real world data tracking, where everybody is collecting your healthcare data. You are synthesizing it using sophisticated AI algorithms, and then giving you feedback on what changes you can do. So, and both on the preventative side as well as on the prescriptive side, there is significant demand. Just the demand for remote monitoring devices during COVID has shot up more than 100%. Like if you are following the telemedicine company stocks, look, those stocks have gone up by almost 100%, or some of them on 300%, because now initially individuals had inhibitions around why I should talk to a doctor on the phone. I want to meet the doctor in person. Now, because of COVID, everybody is now forcing themselves that, do I really need to see the doctor in person? Can I just do it with the phone? Ultimately, the advice that you are going to get is the same advice. Can doctor auscultate you in the remotely? So that is where the trends are changing. Fortunately for India, the majority of the population is 30 to 50 year span, where you get to the adoption to technology is very fast, and it's one of the fastest country that's adopting any new technology. So you will see a significant demand for any remote monitoring devices, any handheld or any smartphone enabled diagnostic devices that you would want to use to inform yourself about your health. And you don't even need a doctor to tell you whether you need it or not. You can do it on a preventative basis to stay healthy. So if you look at healthcare in general, there are areas, remote monitoring is an area that's growing really fast. The second area that's growing really fast is the entire metaverse, where you can plan surgeries and where you can remotely do surgeries. So that is an area. It is the overall market size for that area is smaller, but if you can get the best doctors to do the most complex surgeries around the world without having to physically fly the doctors from one place to another, that could be a big success. The access to the best talent is definitely a challenge within healthcare. Now, taking the insights that are generated from all this, the administrative side of healthcare, which is the health insurance side, is also growing very fast. The health insurance penetration in overall Asia is very low. It is like less than 20%. And if you look compared to United States or America or Europe, the penetration of insurance is in the high 70s. So what that does is the entire affordability of healthcare and having a healthy lifestyle, has a significant positive impact when you know that the financial risk for your health is covered by an insurance company. So the regulations in India are changing, and there is more and more focus on having buying insurance and having insurance company fund the major chunk of the healthcare. But it will take time for that penetration. But as more and more insurance penetration happens, automatically you will see a lot more preventative health being publicized and being available in the market, because insurance companies make money only when you stay healthy. If you end up in the hospital, insurance companies lose money. So the impetus on the devices, anything that keeps you healthy, insurance companies actually pay for it and they incentivize to use it. So you will see that trend catching up very soon in pretty much all of Asia. So I'm going to pause. I know I put a lot of concepts out there. Any questions?
Yes, I see 3 questions in the Q&A box. Should I go ahead and read them?
Yeah, sure.
Okay, so the first one is how a student can start innovation at the laboratory level. If there is a student who wants to start innovation from his college or school, how can he do it?
Yeah, I would say start with identifying the problem that you are trying to solve for. If you just look at the list, there are over, I believe, 90 plus thousand diseases that any literature has covered, but you don't have to go after all 90,000. I look at it. It has to be identify a problem. The problem has to be simple, and the problem has to be a problem that many are facing today in the real world. Yeah, and start with that. Typically, when you want to start solving for a problem, just look at every single opportunity that comes to you, that's something that needs to solve for, and you will land with something that's much bigger.
Okay, thank you. We have another question. Is there a way Indian startups can enter US market? I suppose it is a healthcare startup or something.
To enter US market?
Yeah.
Oh, absolutely. I did the same thing. So it is now a very common trend. So US is a highly regulated market, and so is Europe. You need a lot of regulatory approvals, especially on the clinical side of healthcare if you are doing something. So we are currently incubating 2 companies that are predicting a heart event and also a potential leg amputation event. And these companies, they will need an FDA approval because they are Class A FDA, which is a big approval required for you to sell in the US. But if you are a software company like the one Exponential AI, we are on the insurance side where we are doing real-time AI for all the insurance transactions. We don't need regulatory approval. So ultimately what we did was we built our platform in India, and then we went after the US clients, and we registered a company in India and we launched it in the United States. So right now there is a very good infrastructure, and in future, if you get to a point where you are ready to launch in US, my company will be more than happy to help you guys there. That's the entire philosophy for C3 Ventures.
Oh, that is very generous. So next question is, now that the pandemic is over, can remote technology still grow?
It will grow. So the pandemic lasted for 2 years. I won't say it is over. We just got used to it. So we are now taking it in our strides. Then we have stopped tracking the numbers. The numbers are still there. But once you are in the habit of using a remote technology, everybody has realized how easy it is, how comfortable the life is with the remote technologies. So you will see that demand. And since all of us are engineers here, I can tell you that now that we have collected so much data, that data is very powerful with this remote. If you are collecting the data and you continue collecting it, it is very difficult for any competitor to catch up with you, because they have to go through the same life cycle. Then they cannot accelerate anything without selling more devices. So that data brings insights, and that leads to a much better and smarter device. So it will continue. If it is the age, if you look at 20 to 55 years age, the adoption is high. From 55 years to 70 age, who have not used technology in their earlier ages, the adoption is slower. So it is how you target the right age group population and the right conditions, but it will definitely continue.
Okay. So next is, can we seek regulatory help from the government?
Regulatory help. So it's a tricky question, but let me answer it. So government of India is actually doing some really good things. They have the BIRAC grants, they have partnered with USAID and United Nations on having programs to fund these ideas. But this is just to fund. It does not get you the regulatory approval. You have to have a solid idea and you have to have a solid business model to get approval. Give just the sheer volume that exists today to get it. There's a big line there, and their funds are still limited, but there are good programs that are available to get funding for your ideas. The regulatory approval is required. So, and I'm going to slightly digress. With some of these devices and tech software, you are dealing with individuals' life. If you go wrong, there is no second chance. So you have to make sure it's a foolproof. The success is as near as possible to 100%. And that's why the regulatory process is in place to ensure that. That you have to go through a right clinical trials. You have to demonstrate success percentage with the right clinical trials based on what class you are. And then you are eligible for a regulatory approval. So it's a long road. If you have a very solid idea and if you can build a prototype from build the prototype inception to a regulatory approval, it takes anywhere between 2 to 3 years. But once you get that approval, the path after that is actually very interesting and accelerated.
Sure. Next question I see is most important things to consider while launching product.
Most important thing. So if you look at any new product, there are 3 things you should know. 1, you should have a super high quality deliverable for the customer. Your product should be very solid. 2, your customer. You should know your customer really well when you start designing a product. And 3, your team that's building the product. If these 3 things at a startup level, you have checked these boxes and you are very sure about them, your success is guaranteed.
Okay. So, sir, one more question which I would like to answer. That is how a startup can get benefited by upcoming hackathon. So startup can get benefited through, we will provide, if any idea can selected and problem statement is considered, we will provide the funding support, we will provide the mentoring support, and we will provide the industrial exposure and industrial input to the startups. This is how we are going to help the startups, whoever get selected in hackathon.
Yeah, you guys, all the best. This is a very rare opportunity, but you should make full use of it and give your 100% to win this hackathon.
Correct, sir.
Yes, so there's a question about metaverse. Someone is asking that, as you earlier mentioned, we can combine metaverse and healthcare. What is the scope?
The scope is unlimited. So it's a newest concept. Here are a couple of ideas that I have been introduced to. So the entire idea of shopping for healthcare. So if you look at so ignore the cities in India, but if you go rural, healthcare availability of healthcare is very limited. Correct. Other than the government hospitals and a few handful of doctors, the villages don't have a lot. Right. So to educate the people in the rural India, metaverse can play a big role. This is about what's the best that can happen. If somebody is complaining about a health issue, they really don't know which doctor to go to because there's only one doctor in the village. So he has to walk to that doctor. They don't know if he is the right doctor. They don't know if the doctor has the right resources. So imagine a metaverse where somebody just says, I have a chest pain, and then the options start coming up and saying, you know what, we are ordering a cab for you, or a Uber will come, sit in the Uber. This doctor is not the right doctor. The nearest doctor is an hour away. You might want to pick up this medicine from this pharmacy, and a 3D image comes where the pharmacy is shown exactly where it is, and the medicine is highlighted. And those are the concepts that people are talking about right now on how they can simplify a healthcare experience. Remember that 60% of the population across the world, they really don't understand what they are going through. They are just experiencing, and they are exposing a symptom. So walking them through the journey of how to narrow down the root cause is something that a doctor does today, and every doctor has a different skill of doing that today, right? And metaverse could be a good supplement for that, especially when the places where there is no healthcare available.
Okay. So I guess there are multiple opportunities. It's just how you seek it.
Absolutely.
Identify.
Yep.
So another question is related to this only. I mean, are there any innovation ideas for rural areas?
There is a significant rural idea. So I'll tell you, and it's already in place. So you guys, it's not something now innovative. There are a lot of like command center that are coming up, especially in rural areas. So most of the rural areas in India, the healthcare is publicly funded, which means there's a government hospital with limited facilities and nursing homes. Typically 20 to 30 bed, not more than that. And then there are a few handful of doctors. Most of them are general practitioners. There is no specialist. And if you take that scenario, and on an average, the population is anywhere between 20 to 50,000 range. So there is a significant need for the healthcare resources and healthcare technology. So if something you might have experienced or seen or you are working with is mobile X-ray clinics, where the X-ray is taken wherever the patient is, and it's loaded to a cloud, and an AI algorithm gives you a potential diagnosis. See, those are the ideas where there is no radiology clinics in the rural India. You can actually provide these sources. Same thing on remote heart ECG devices. There are now pocket held ECG devices. You just give it to the patients who are heart patients, and monitor their heartbeats remotely, because they don't have a cardiologist within their reach. So there is no limit to what you can do in healthcare for rural India today. The accessibility and affordability, both you have to solve for to make healthcare in rural India better. Access to the healthcare resources and how to make it affordable, because even if the access is there and you can't afford it, you are not solving for healthcare. So you have to solve for both.
Correct, sir. One more question which I would like to answer, sir. It is about the hackathon. Since how much funding support, since we are providing a funding support of up to 7 lakhs. Once you get incubated with the SIIC, which is in IIT Kanpur, you will get follow of various funding schemes, which you will get benefited once you get incubated with us.
Yeah. And Imran, do you want to just give an idea of how many companies we are incubating today?
Sir, we have incubated around 150 companies in SIIC. And from ideation stage to prototype to go to market stage. So we have supported at starting level till the execution of their project, I can say, till they go to the market. And we help them in various routes level. Like when they are in ideation stage, we help them to go with their idea, work with them idea to make their idea viable and get the shape of the idea. Then they
for the participants, guys, I have started, I'm also on the board of many incubation programs,
Yes.
and IIT Kanpur is one of the leading programs there, and they're taking a lot of interest. And then they have a very strong panel of mentors that
Correct,
they
sir.
have put together to help the incubators. So it will be an honor for you guys also to be a part of this incubation program.
Correct, sir.
Give it your best.
Sir, we will all try our level best, and definitely all the startups which are incubated with us, they will get all what they want from our level.
So can we move to the next question? There
Yep.
is, okay. So there is a question, how can material engineering help with new devices? Anything about material engineering?
Oh, the material engineering is going to be pivotal. And I have been introduced to prosthetics. So there is prosthetics is an area where material engineering can be significantly helpful for building new devices. Beyond that as well, making the devices more durable, more adaptable. See, the thing about healthcare is, even if you look at building these devices, everybody's body shape, body structure is different. You go from one person to another, nevertheless move from one country to another country. So having material engineering transform these devices to make it more adaptable is going to be pivotal to the success. The adoption will be driven by the material as well as the hardware and the software. Let me put it this way. And material engine has a big role to play in the hardware part.
Yes, sir.
Yes, sir.
So I don't see any new question, but I would like to ask one. Do you have anything to share that you have learned during your entrepreneurial journey? Like any three important things?
I learn every day. Every day is a new day for me. Well, let me give you my history. My entrepreneurial journey only started 5 years back. When in the true sense, let me put it this way, I had always a passion for scaling companies, taking a business idea and making it bigger. So past my engineering, I started getting introduced to the BIFR companies, which is bankrupt companies. The idea was to take these bankrupt companies and restructure them to make it bigger and better. And I really enjoyed it because that time I don't have to think about a business idea. I had to think about how to do business better. So I honed that skill. I took that skill, went to business school, and then got introduced to healthcare and became deeply interested in healthcare, and joined an early stage startup company which was a health insurance company. And I like how they were making the healthcare affordable. And we took that in a span of 3 years, we made that company a Fortune 500 company. So we took that experience, said that at that point, it just became too repetitive for me. So I said that I don't enjoy being a part of like huge corporations. Once I make them bigger, I need to move on. So one of my clients who was trying to build a shared services platform for healthcare to make it more affordable, we built this platform from scratch almost 8 years ago, and we made it into $1 billion company in the span of 3 years. So loved that. But in these two experiences, there was always significant financial backing from large corporates. So then that's when the idea came is now it's time to do something where it has to be truly, you can say that we sowed the seed, we made the tree bigger, and now it's different. And that journey started with Exponential AI almost 5 years ago. So we hired the team. I put my own sweat equity in there. Got a bunch of really strong investors who could back me in this, and we have built a platform right from concept and with a very clear problem to solve, and then launched it in the market. It is a very tough journey. The way I describe it to my wife is, this company is my third and the youngest child. The other two are little independent. This is still not independent. It is still crawling. I need to get it standing and running very soon. So it does require a lot of personal sacrifice. it does what it builds in you is humility. Like when you go from a senior company executive where you have a big entourage following you everywhere to a president of a small startup where you have to do your own Xerox machines, you have to send your own mail. It's a different experience, but it really makes you a stronger and a better person. And most importantly, it teaches you to look at things differently. Like everything is, no hurdle is a hurdle anymore. It is just a stepping stone for a bigger and then next height that you want to go. And the attitude in that is a significant change, and you have to live through it to experience it. Nobody can teach you that.
Is an in and out growth process. Like
Absolutely, yes.
growing every day. There's another question. Is it a good idea to go for a narrow customer base?
Can you repeat your question, Akanksha?
Is it a good idea to go for a narrow customer base? If
So I will give you a scientific answer to this. Whenever you go niche, it is always a high margin business. So, and even if you start with I would say it's not a bad idea to go with a narrow customer base. You should always have a vision though, and what you are after. There are a lot of companies that are catering to a narrow customer base. So a good example would be the submarine diesel engines or the nuclear powered submarines. It takes 2 to 3 years to build one, and the buyers in the market are fairly limited. Now, if you call that a narrow customer base, you cannot have a narrower customer base because there are like maybe 5 buyers in the market and you are building one engine, but the one engine cost is $500 million. So if you think that is something you want to go after, absolutely. But at the same time, if you are making super hygienic, super healthy lemonade, which does not test well, and it's going to charge you 10 rupees for it, and there's only one buyer, then it is a bad idea. So, but niche is always high margin. So if you have a strong product idea that caters to a narrow customer base, go for it. Instead of building that, but keep your vision on how you can grow your customer base further.
Okay, that will really help.
So
we have another question. Can a student be an entrepreneur while studying? Are there any organization that help students?
So you can be an entrepreneur any point in your life. You don't have to be a student also. An entrepreneur, and an entrepreneur is a student by default. He is learning every minute, every day. If you have, I'm sure now you guys are hooked to Shark Tank India. Shark Tank has been in US for last 6 years, but look at that. There are people in there. The one example I remember, the guy who built this tricycle that will sow seeds on the farm, right? And he had no professional qualification to do it, but he wanted to solve a problem. And then he built it, and he wanted to then scale it and give it to every farmer that was in the rural areas that couldn't afford any other vehicle, make it affordable. So are there any organizations that will help you? Not formally, but there is no shortage of individuals and mentors once you have a strong idea to validate it and then take you to scale.
Yeah, true.
correct, sir. So everybody is somehow a little or strong entrepreneur. Some show their skills, go move ahead. Some being the entrepreneur at their level, but anyhow, everyone is trying to bring their idea in front of and try to solve the problem statement.
I guess we have answered all the questions. Are there any organization that help students?
Organization help student for entrepreneur. We are the organization. We are helping the students.
Yeah, the incubation program is there. Go.
We are the only organization. We are working on the problem student of this problem statement of the student.
Yes,
so organization is there. Your idea is waiting. Come soon.
Right. So we are done with the questions here.
We are completed with the questions, sir.
Awesome. Thanks a lot, guys, for your time. And if any further questions, feel free to reach out and we'll be more than happy. And all the best for your hackathon.
Thank you so much. Thank you for your valuable session. It's been a nice talking to you. Definitely, we are going to connect with you, sir, with various problem statement also and interaction also.
All right, awesome. Thank you, guys.
Thank
Have
you
a nice day.
so much, sir, for your time.
Thank you, sir.
Thank you, sir.